Hi there! How nice that you showed your interest in our master's program. My name is Mark Bruinzels and I'm the Educational Director of this program. In this short video I will tell you a little bit more about the activities during the program and the job and work possibilities after the program. Did you hear about the headlines and stories on shortage of staff in all kinds of healthcare facilities? Or about new solutions through technical innovations that look really promising for improving health? And what about that at the same time there's the decreasing life expectancy for some of the poorer populations in high-income countries, with increasing health differences between the rich and the poor as a consequence? Did you hear about the increasing obesity pandemic and the rising costs of healthcare? If you want to put your teeth into these issues, this is the right master for you. These and other developments within and outside of healthcare are all challenges for future health professionals and organizations. But how to cope with these challenges while at the same time dealing with larger groups of patients? And how do we keep our healthcare sustainable and improve at the same time the health for the whole population without increasing the differences between the rich and the poor? This master's program makes you competent to contribute to a future-proof healthcare that realizes better health for all individuals and populations. In our master's program, the focus is on acquiring competences to tackle these problems now and in the future at a more strategic level. We do that through thorough academic initiatives and personal development. The learning within our program is organized around real-life problems brought in by our network partners. We do have a very large comprehensive network at local, national and international level of all kinds of healthcare and relevant stakeholder organizations. This network is organized around the health campus in The Hague, in which we collaborate with hospitals, general practitioners, social care. The policy level, the Ministry of Health is at the corner, and all kinds of health insurers. Through this collaborative network of all these organizations, our students can cover the whole continuum of care and not only focus on public health or on medicine or on specific parts of health policy, but they can cover these issues transdisciplinary, look at them from a whole perspective. So look, what did Fleur do? Fleur advised about the organization of intensive care beds for children with rare diseases. She did it through a combination of data analysis and interviews with patients and healthcare providers. She came up with solutions that are not only medical or logistic-wise, solutions were also relevant in the behavior of patients and providers and in the financial incentives. Jessie developed a new data algorithm to assess the cost effectiveness of interventions for patients with cardiovascular disease. And Emily, Vincent, Harmer, Greta and Kenneth, in a group project, dealt with the influx of elderly patients at the emergency care departments. Solutions they found were at the level of the preventing of loneliness and frail situations in specifically patients with health problems that have unstable or hardly any social networks. So you would see that solutions require a combination of medical and social aspects of life. Steintje studied the development of birth care programs for ethnic minority groups that dealt with legal status issues and fear of losing income through absenteeism at work, which is an example of a problem outside of hospital. So all problems, all solutions, all issues are not straightforward or one-dimensional. They require a combination of medical expertise, social determinants, and a good analysis of the decision-making process of all stakeholders. Data, and big data in particular, are in all examples important drivers for the analysis, and we put extra emphasis on financial incentives through, for example, new payment models. So the interdisciplinary perspective is emphasized in all our curriculum. What did the students really like about our curriculum? On number 1, they said, we are dealing with real-life challenges. Challenges they work on during the various courses, the internships, and in their research thesis. It doesn't remain academic, but they are really working on practical applications that are relevant for various stakeholders. They also mentioned the small-scale curriculum, which they really like, and they form a very nice, cohesive group. During the past 2 years, the students experienced they were in charge of their own education. So if you want to be in charge of your own learnings, this master's is for you. You are in charge of your own education, especially in the free format second year, in which we offer only support and guidance, and you determine your own direction. Already excited? And of course, you also want to know about the job prospects. What you want to know where you can find yourself in 5 to 10 years' time. Fortunately, the job market for PHM is growing worldwide, as we show in other presentations of this master's. But there's a new program that runs from 2021. We do not have an overview yet of all our students that graduated, where they ended up. Although we have some indications of our recently graduated students, where they end up. They got jobs at the health insurer, in a hospital, at a consultancy firm, or at research facilities. All these jobs relate to the population health management domain, and they are jobs like purchasing integrated care, advising hospital CEOs for future positioning, or contributing in brand new regional network initiatives. I am confident that all our graduates will end up at strategic level jobs within healthcare related organizations, as the current system is running out of flexibility. New ways have to be explored, and that's what this master is about. So that's it for now, and I hope I inspired you to consider population health management to expand your competences. At our website you'll find more information about our masters, and I hope to see you in person at one of our next events.